Welcome back. One of our top stories tonight talks about booster shots. The CDC's Advisory Committee on Immunization Practices met today to try to make some plans.
Yeah, ultimately, they didn't hold a vote. The White House says it plans to offer booster shots by the end of September, but that's up to the FDA and the CDC. Of course, this all comes as cases and hospitalizations are surging. As new COVID-19 cases in the U.S. surge to levels not seen since January, averaging more than 155,000 a day, there is a grim new prediction. The country could see 100,000 more COVID deaths by December. That's according to a University of Washington model.
What is going on now is both entirely predictable, but entirely preventable.
Health experts say there are 80 million people eligible for a vaccine who haven't gotten one. Mississippi and Florida are leading the nation in new cases per capita.
We could turn this around and we could do it efficiently and quickly if we just get those people vaccinated. This is very, very important, not only for your own health, but for the health of the country.
COVID deaths continue to rise all across the U.S. At nearly 1,300 a day, the 7-day forecast of deaths has jumped nearly 30% over the last week. And with nearly 100,000 people hospitalized with the virus and about 30% of ICU beds occupied by COVID patients, another problem is now emerging: not enough oxygen to treat them.
We're seeing the younger patients, 30, 40, 50-year-old, and they're suffering, they're hungry for oxygen, and they're dying.
Several hospitals in South Carolina, along with Texas, Louisiana, and Florida, are at risk of having to use their reserve supplies or just running out of oxygen. Meanwhile, a Central Florida medical coalition bought 14 portable morgues to help with the unprecedented number of COVID-19 deaths.
Some of them are reaching a point in terms of their storage before they can cremate bodies. They're at or near some capacity.
And as more and more kids head back to school, a doctor from OHSU weighs in.
There's no question that we're headed into a really tough time for young people.
Thousands of students are already quarantining due to COVID cases. Experts say vaccine mandates for in-person learning should be on the table for eligible children.
We've done this for decades and decades, requiring polio, measles, mumps, rubella, hepatitis. So this would not be something new, requiring vaccinations for children to come to school.
For kids ages 5 to 11, Pfizer expects to submit data to the FDA in September and apply for emergency use authorization in October.